Hi, Joy and everybody, and thank you for allowing me to make some comments about East Palestine and Medicare for All. I'm sorry I can't join you in person, but I'm on a vacation right now, and so I'm recording this in advance. My name is Dr. Walter Tsou. I have been a long-time single-payer advocate, and also I work with Physicians for Social Responsibility here in Pennsylvania, where we work on climate change and other environmental threats, period. The East Palestine event in Ohio was right over the border from Pennsylvania. And so people in our state were directly impacted by the vinyl chloride that was burnt in East Palestine. It is ironic that even as I speak right now, Congress is holding hearings with the National Transportation Safety Board on the East Palestine accident and what are the lessons that we can learn from that. One of the lessons that we can learn is that we decided, perhaps rightly, perhaps wrongly, that by burning the vinyl chloride in 5 tanker cars and spewing the environmental toxin throughout the East Palestine community, we have actually permanently exposed hundreds, if not thousands, of people in East Palestine to the vinyl chloride toxins and contaminated the groundwater that they drink. And it's not just East Palestine, but the entire area, including wafting over into the Pennsylvania border, that we are concerned about the air pollution that came from East Palestine. Norfolk Southern, who owned the railroad and tanker cars, has said that they plan to be in the East Palestine area, not just tomorrow, but for the next 5, 10, 15 years. Well, the truth is that given what we know about the exposure to vinyl chloride and other VOCs that came from the tanker car in East Palestine, they're going to have to be there likely for the rest of the lives of individuals, because these type of carcinogens do not happen overnight. They actually happen over 5, 10, 15, 20, 25 years over the course of one's lifetime. And so one of the lessons we learn is that you need lifetime care in order to care for people who have been exposed to these type of environmental toxins. Another lesson that's interesting is an article that I point out to you that my good friend Kay Tillow in Kentucky wrote on April 14th in Counterpunch, and I strongly urge you to find that article and read it. In the article, she talks about East Palestine, Libby, Montana, and Medicare for All. So what's the connection between these three comments? Well, it turns out that when the Affordable Care Act was written back in 2010, the author of the bill was largely a Senator, Max Baucus, a Democrat from Montana. And Senator Baucus actually made a special provision in the Affordable Care Act to guarantee health care, Medicare coverage for everybody in the small town of Libby, Montana. And why is Libby, Montana singled out for this special treatment? It's because the W.R. Grace Company, which was in Libby, Montana, did the mining for asbestos, the vermiculite that actually was turned into asbestos. And the workers were given no protections. They would bring it home in their clothing. The people would wash the clothing in their laundry machines, and the wives and children were also exposed to the asbestos fibers. And from what we know about asbestos, there is no safe threshold for asbestos. So all these people who were actually exposed to asbestos came down with things like mesothelioma, asbestosis, and other lung disease and cancer problems that have plagued Libby, Montana, and all its residents because of their environmental exposure. So Baucus, who knew about this, decided to slip into the Affordable Care Act a provision that provides funding, regardless of age, for Medicare coverage for anybody who might have been exposed to this asbestos. This type of special carve-out was done because he was the chair of the Finance Committee, and he was Senate Finance Committee, and he was able to do that. But the point here is that when you're dealing with environmental exposures that could actually last the lifetime of an individual, you really do need some type of lifetime coverage. And Baucus realized this, and so he slipped in this provision for Libby, Montana. So now we come to East Palestine, who have also been exposed to vinyl chloride and other VOCs that came off. They breathed it in. It contaminated their groundwater. And now we have the task of following the health of these residents for the next decades, perhaps for the rest of their life. And what better way of doing that than perhaps to provide them with lifetime coverage in the same way that we did for Libby, Montana. Well, that's the point of Kay Tiller's article in Counterpunch. But it does raise the whole issue of how many people across this nation have been exposed to all kinds of environmental toxins. We know in Pennsylvania, for example, lots of people have been exposed to fracking, PFAS, radioactivity. All of that are contaminants that come from the fracking process. And it's gotten into the groundwater, it's in the soil, and it's polluted the air. What about Cancer Alley in Louisiana, or the toxic areas near the oil refineries in Houston? And what about all these other areas that are near Superfund sites across this nation? If you add it all up, you're talking about millions and millions of people who are potentially exposed. And the only real logical remedy to provide lifetime coverage for all these people who have been exposed to these environmental toxins is a Medicare For All program. It turns out that in the long run, it is not only the cheapest way to do it, it's the most moral and humane way of providing coverage for everybody in this country, including those who have not been exposed to environmental toxins, but are equally deserving of coverage. So the point here, I would say, is that we need Medicare for all. We need it now, and it's long overdue. And I think we should not be carving out exceptions just for Libby or East Palestine. We should do it for everybody. Thank you for the time to talk about this.